Hi friends, today's section is the continuation of our last video. We are discussing about the amniotic fluid disorders during pregnancy. The last class was oligohydramnia. So no doubt today we will discuss about polyhydramnias. First of all, we'll discuss about what you mean by polyhydramnia. Polyhydramnia is a condition characterized by excessive amniotic fluid during pregnancy. That is, more than 2 liters of amniotic fluid during pregnancy. The amniotic fluid index will be varies according to the gestational age. If the amniotic fluid index is more than 25 cm, we consider it as a polyhydramnia. Usually this condition occurs 1 to 2% of pregnancy. This polyhydramnia can be badly affect the outcome of pregnancy. Next, we'll discuss about the causes of polyhydramnia. The causes of polyhydramnia mainly classified into two ways, the maternal cause and the fetal cause. First, we'll see the fetal cause. The first one is swallowing impairment. Fetal swallowing impairment such as esophageal atresia or facial cleft can lead to fluid accumulation. The second cause is CNS disorder. Central nervous system disorder like anencephaly prevent proper fluid regulation by the fetus. The next cause will be the chromosomal issues. The condition like trisomy 18 and Down syndrome are often associated with the polyhydramnia. Fetal anomalies are responsible for 15 to 20% of polyhydramnia cases, highlighting the importance of through prenatal screening. Next, we will discuss about the maternal causes. In that, first one is maternal diabetes. Gestational diabetes is a significant contributor accounting for 10 to 20% of cases. The second one is isoimmunization. Fetal anemia resulting from isoimmunization can lead to increased fluid production. Third one is multiple gestation. Twin to twin transfusion syndrome in multiple pregnancies can also cause polyhydramnias. The last one is idiopathic cause. In a large percentage, like 50 to 65% of cases, no clear causes can be identified. Apart from that, some maternal infections such as urinary tract infection also can cause polyhydramnia. Next, we'll discuss about the signs and symptoms of polyhydramnia. It includes shortness of breath. The excess amniotic fluid will apply more pressure on the diaphragm and lungs, which can lead to shortness of breath. The second symptom is abdominal discomfort or pain. Some women experience abdominal discomfort, pelvic pressure, or back pain if they have this polyhydramnia. The next symptom is swollen abdomen. If there is polyhydramnia, when we check the abdominal health, it will be more than the gestational age. So these are the main signs and symptoms of polyhydramnia. Next, we'll discuss about the diagnosis of polyhydramnia. The polyhydramnia can be diagnosed with the help of ultrasound scanning. In the ultrasound scanning, we can assess the amount of amniotic fluid. If the amniotic fluid exceeds more than 2 liters, we consider it as polyhydramnia. So when we check the amniotic fluid index, it should be more than 25 centimeter. The other method of detecting the polyhydramnia is assessing the maximum vertical pocket. If the maximum vertical pocket is more than 8 cm, we consider it as a polyhydramnia. The maximum vertical pocket method measures the single deepest point of amniotic fluid. This approach offers a quick assessment and is used alongside amniotic fluid index for a comprehensive evaluation of amniotic fluid level. So these are the method to identify the polyhydramnias. Here we reach the management aspect of polyhydramnia. The first one is monitoring. Regular ultrasound check to track fluid level and fetal well-being is very essential. The second one is amnio reduction. Removing excess amniotic fluid through a needle to relieve discomfort and reduce the risk of complication. The third management is treatment of underlying conditions, managing maternal diabetes or other underlying condition to reduce the risk of polyhydramnia. The fourth one is preterm labor management. Polyhydramnios increase the risk of preterm labor. Management may involve corticosteroid and other medications. Next, we'll see the complications of polyhydramnia. The first one is preterm labor. Excess amniotic fluid can lead to preterm labor and birth. The second one is placental abruption. The placenta may separate from the uterus, causing bleeding and other complication. Third one is postpartum hemorrhage. Women with the polyhydramnias are at increased risk of postpartum hemorrhage. This is about polyhydramnia. It's a simple topic. I hope all of you understood about polyhydramnia. It is nothing but excessive amniotic fluid during pregnancy. That means the amniotic fluid is more than 2 liter or the amniotic fluid index is more than 25 centimeter is called polyhydramnia. Usually this can affect the pregnancy outcome very badly. So here we can wind up our today's section. In the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.